Hello, welcome to this lecture on the key frameworks for scaling up NCD programs. Today, we are going to focus on the uses of scale-up frameworks. We'll then move on to looking at 5 different types of frameworks. Then we will look at the common strengths that run across some of these frameworks and finally end with the implications or the considerations of some of these frameworks for NCD programs. Let's first look at the pros and cons of using such structured frameworks. There are quite a few pros. So, for example, they provide a systematic approach to scaling up. They offer a structured way to think about the complexities of scaling up interventions. They help researchers identify key factors, prioritize activities, and develop a comprehensive plan. They also enhance our understanding. They can help researchers gain a deeper understanding of the factors that influence successful scale up, such as context, implementation strategies, and stakeholder engagement. They can provide a common language and shared understanding amongst researchers, policymakers, and practitioners, which can improve communication and, very importantly, collaboration. But these frameworks are not without their limitations. For example, they may not be flexible enough. Some frameworks may be too rigid or prescriptive, making it difficult to adapt them to the unique needs and challenges of specific contexts. Many times they can be complex and time consuming, which means that applying frameworks can require a significant effort, especially for complex interventions and large scale projects. They may not capture all the relevant factors that we are interested in. So, for example, they may not adequately address all of the factors that are important for successful scale up, such as political factors, economic constraints, and ethical considerations. They may not be widely accepted because there is no single universally accepted framework for scale up, which can lead to confusion and inconsistency in research and practice. So, in summary, these frameworks have their own advantages and disadvantages. And now we'll look at some of those to try to understand what the advantages of some of those are. The IHI framework for going to full scale is just one example of such framework. It describes 3 components of successful scale up. Firstly, a sequence of activities that are required to get a program of work to full scale. Then the mechanisms that are required to facilitate the adoption of interventions. And finally, the underlying support systems required for successful scale up. It does this by defining 4 phases required to get to full scale. Phase 1 is the setup phase, which prepares the ground for introduction and testing of the intervention that will be taken to full scale. Phase 2 is developing the scalable unit, which is an early test and demonstration phase. Phase 3 is then testing of this scale up, which spreads the intervention to a variety of settings that are likely to represent contexts that will be encountered at full scale. And finally, going to full scale, which unfolds rapidly to enable a larger number of sites to adopt and or replicate the intervention. While this sequence, as you will see from this diagrammatic representation, reflects a logical progression from conception to full scale, in reality, you have to remember the phases may not be linear. Rather, they may be more organic and iterative, with streams of work initiated at different times and, very importantly, progressing at different rates. ExpandNet scaling up framework is another example of a scale up framework. It consists of 5 elements inside the oval that you see on the slide, with the scaling up strategy as the centerpiece and 5 strategic choice areas which you see in the boxes outside the oval. This framework is guided by 4 key principles, and these are: 1. Systems thinking; 2. A focus on sustainability; 3. The need to determine scalability; and finally, and very importantly, respect for diversity in terms of gender, equity, and human rights principles. The innovation that you see in this framework refers to health interventions and or practices that are going to be scaled up. The user organization or organizations refer to the institutions or organizations that seek to or are expected to adopt and implement the innovation on a large scale. The environment refers to the conditions and institutions which are external to the user organization, but fundamentally will affect the prospects for scaling up. The resource team refers to the individuals and organizations that seek to promote and facilitate wider use of the innovation or those which are promoting the scale up. A resource team may be formally charged with promoting the innovation or may act informally in this role. The scaling up strategy refers to the plans and actions necessary to fully establish the innovation in policies, programs, and service delivery. Through this framework, we can do different types of scaling up. So, for example, there is vertical scaling up, which is institutionalization through policy, political, legal, budgetary, or other health systems change coming from right at the top. Then there is horizontal scaling up, which is expansion and replication of a model of the intervention. Then there is diversification, which is basically broadening the range of services that are offered through the program. And finally, spontaneous scaling up, in which the intervention is not adopted through a specific and very planned strategy, but is adopted by many actors in a more organic manner. Then there is the NAS framework. This was developed based on a literature review and a lot of empirical case studies. And it was very basically developed for studying the non adoption, abandonment, and challenges to scale up, spread, and sustainability of technology supported change efforts in health and social care. This is slightly unlike the other frameworks that we have spoken about. Such projects meet problems usually because they are either too complex or because the complexity is suboptimally handled. This framework consists of six domains: the illness or the condition that you are trying to respond to or tackle, the technology, the value proposition of the intervention that you're planning to scale up, the individuals who are intended to adopt the technology, the organizations, and the wider system, along with the seventh domain that considers how all of these interact with each other and evolve over time. This framework is not intended to provide a predictive or formulaic solution to technology adoption. Rather, it should be used to generate a rich and situated narrative of the multiple influences on a complex project, to identify parts of the project where complexity might be reduced, and to consider how individuals and organizations might be supported to handle the remaining complexities in a more better and sustainable manner. Here is a more zoomed in view of the NAS framework, and I'll leave this on for a while. But when you are listening to this lecture, you could pause at this point and look at this in slightly more detail. Here is another framework called the Mayo Clinical Model of Diffusion. The five key elements of this diffusion model and how they relate to another as follows. So firstly, leadership groups such as the Mayo Clinical Practice Committee or specialty councils or other groups may initiate the development of a new practice, or it may indeed evolve from frontline staff. After such a best practice is identified and approved, the expectation is that it will be broadly diffused and constantly monitored and updated as necessary. In this Mayo Clinic model of diffusion, diffusion of best practices depends on three primary enablers: culture, engineering, and infrastructure or systems support. It includes five key elements: leadership, value creation teams, diffusion actions, operational implementation, and best practice review and maintenance. After a best practice is approved, it moves into the managed diffusion phase as per this framework. And diffusion managers at each site then shepherd this diffusion process, primarily serving as agents to help carry out the change. Here is another example of a framework for scaling up community based health promotion, a very specific kind of a framework. What this framework does is many things. One, it considers attributes and features of the innovation that affect the scaling up process. It gathers relevant initial parameters, observes processes, secures results, and reacts to changes in a timely manner. It will try to gain and preserve political commitment and advocacy at various levels through individuals, but also through institutions and policies. It will help develop early stakeholder and organizational engagement in the process, establish and sustain partnerships and networks. It will identify and define formal and informal roles and the responsibilities and opportunities in the scaling up process, very importantly, in a transparent manner. It will enable active involvement of a range of relevant stakeholders through the whole scaling up process and foster the ownership of the innovation by its users. It will try to promote and impart personal as well as organizational skills and knowledge to enhance capacity. It will realize phased, scheduled, anticipatory, and coordinated decisions and actions and iterative processes to scale up the innovation. It will raise and ensure durable availability of financial and personal resources for the sustainability of the innovation. It will establish transparent communication structures and appropriate channels to forge relationships between various stakeholders and disseminate information regularly, adapted formally as well as informally. After having gone through these various frameworks, let's just take a few moments to pause for thought and reflect on these two issues. What factors influence your selection of theories or frameworks for any implementation research project that you are involved in? And when you select a framework for scaling up, would you consider the same or different factors and why? Just take some time to reflect on this and see what you come up with. While we looked at various different frameworks, or five of different types of frameworks, this is not an exhaustive list. But even then, from these five frameworks, we are able to draw some common trends which run across all of these or most of these. So one is all of them focus on context, and scaling up cannot happen independent of the context in which the programs are being implemented. They focus very much on multi-level engagement and not just at a single level. The focus is on being nimble on your feet when implementing programs, and so there's a lot of stress on adaptation as well as flexibility. They focus on the longer term maintenance and sustainability of the program. They also look at a more phased and incremental implementation of program rather than scaling up in one go. Monitoring and evaluation is an important part of all of these frameworks because they then help to iteratively improve the program through the feedback that you get from the monitoring and evaluation. Both leadership of the program and engagement of various stakeholders is an important trend that runs through most of these frameworks. Focusing on the resources that are available, generating new resources, and enhancing the capacity of the existing and new resources is a very important trend that runs through this program. And finally, these frameworks are focused on integrating the new programs or new interventions within existing systems rather than creating new parallel systems. So having considered the commonalities of these frameworks, what are the applications of some of these frameworks to NCD programs? One, they teach us that you need to tailor your program to local settings and contexts. They tell us that it's very important to engage with and collaborate with various stakeholders such as policymakers, health systems leaders, healthcare providers, and community members who will benefit from the program that you're trying to implement. What they tell us is that it's important to start on a smaller scale before scaling up to larger populations. They also tell us that it's very important to embed long-term sustainability in the design even when you are starting off. It's important to ensure continuous monitoring and evaluation of the program and using the lessons that you learn from the monitoring and evaluation to iteratively make your program better. It's important to integrate your intervention when you're scaling up into the broader healthcare infrastructure and not just create something new. And very importantly, address not just the treatment aspects for NCD, but also prevention. And finally, and very importantly, ensure that there is adequate allocation of financial and human resources right at the outset so that you can maintain or sustain the program in the longer term. And finally, I would like to summarize some of the key messages that I would want you to draw from this lecture. Firstly, structured frameworks are very useful to guide scale up. While we might be doing things in unstructured manner, trying to implement or trying to integrate structured frameworks in our programs would be very useful. While we acknowledge the importance of using structured frameworks, it might sometimes get complicated because there are several frameworks that are available. We have just spoken about 5, but there are many more than that. Look at various different ones and choose the one that works best for you and your context. But having said that, there are several frameworks. I would also like to reiterate what I've said earlier, that while there are differences between these frameworks, there are several commonalities as well that guide these frameworks and which should guide your program as well. And finally, using such frameworks for scaling up NCD programs that you are involved in will ensure the success of the programs. Rather than trying to organically scale up your programs, use one or more of these structured frameworks to help you to scale up your programs in a sustainable manner. Thank you.